NRTI, NNRTI.
Yes,
you know,
all of the drugs
they have different effects though. And
sound
it's like, what does that mean?
very similar. All right, so the treatment for HIV is ART therapy, which is antiretroviral therapy. Because HIV has gotten very smart over the years, it is resistant to some drugs. So we never just use one drug to treat HIV. We usually do a combo of at least 3 drugs. Every single HIV drug is liver toxic. So then you're piling liver toxic on liver toxic on liver toxic. All of your TB drugs are also liver toxic. And it is very common to have HIV and TB at the same time. So liver, 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 liver.
I hope you don't drink alcohol.
Yeah, you cannot drink alcohol in the history of ever. All right, so if you look, like back on the patho, remember I told you I like highlighted some of the parts of the patho because these drugs are going to work on these different parts of the patho. So you've got nucleoside reverse transcriptase inhibitors. So it's going to inhibit it way up here, right? You've got integrase inhibitors. You've got protease inhibitors. Y'all see that?
Yes.
Okay. So what I did do for this, because we're going to cover HIV drugs much more in pharm, this is just your little cheat sheet. Okay. So NRTIs, I just gave you a acronym to remember those drugs. It is T's. Okay. I know that sounds really kind of gross, but it is the way that it is. You've got NNRTIs, efavirenz is a big drug that they like to test on. And then you've got protease inhibitors and integrase inhibitors. So you can see these work on all different stages of the HIV. That's why you have to combo other drugs as well, because you want to hit it in case any slip through the cracks, right? At the beginning part of the patho, you catch it at the end. Do you understand what I'm saying?
Yeah.
Okay.
So you get at least 3 out of these 4 different
drugs. Yes.
Okay.
Yep. Okay.
Yes.
Okay. But before I start HIV, nope, not me. Before we start the patient on HIV treatment, okay, I never try to put diseases on anyone. Before patients start on HIV treatment, we're going to do the following labs and you're going to give me a rationale why. Why would I do a CBC? I need to look at their white blood cell count. Sure. Why would I do a fasting lipid panel?
Wasting syndrome.
Wasting syndrome, sure, but they're also, all of these drugs are going to be liver toxic. Same with the hepatitis panel, right? We do STD screens because remember HIV and STDs kind of go hand in hand, right? So we'll do a GC, which is a gonorrhea and chlamydia, a HSV, which is herpes simplex virus, an RPR, which is, what is that testing for? Don't worry about what it stands for, just what disease is it testing for. I've already covered it with you today. It's Swiss cheese brain, y'all.
Oh, syphilis.
It's syphilis, RPR is syphilis. We're going to do a CMP. What is a CMP? Comprehensive metabolic panel, because once they get the diarrhea, they're going to have massive electrolyte imbalances. Yes. We'll do a toxoplasmosis test. What do we say toxoplasmosis was? The one that you get from kitty litter boxes. We'll do a pregnancy test. How come?
You don't want them to be pregnant
These are
again.
probably category B plus.
Yeah, some of these are not meant for pregnancy. So
The baby.
yes, but there are also certain drugs, certain ARTs I do give during pregnancy to decrease the risk of perinatal transmission. Because y'all know mom and baby do not switch blood in utero, right? But at delivery, mom and baby will switch blood. So we have mom be on ART all through pregnancy and sometimes up to 6 weeks after delivery. And then when mom is giving birth, we will do an infusion of IV zidovudine to decrease the risk of transmission between mom and baby. I don't know if I put that somewhere, but anyway, just let you know. Okay. CD4 counts, because what are we need a baseline, right? Because as HIV progresses, their CD4 count decreases and viral load increases. So how am I going to know if the treatment's effective? I need to know what their CD4 count, their CD4 percentage, and their viral load is. Why would I do a pap smear?
For cervical cancer.
Yes, for HPV virus, cervical cancer, because we know that invasive cervical cancer is an opportunistic infection. What is a PPD?
TB test.
It's a TB skin test, right? Because TB and HIV also go hand in hand. And then we need to do resistance testing because a lot of HIV, because it's become very smart, it has become resistant to a lot of treatment. Okay. Watch the liver. Do you understand?
Yes.
Okay. So that means LFTs, yada, yada, right?
Before jaundice.
Huh?
Report
Report jaundice. I don't know what I thought you said. Sorry, I looked at you weird. All right, no St. John's wort with these medicines because it is going to interact. Okay, so they cannot take St. John's wort.
So are these P450 then?
A lot of them do end up being P450, and isn't St. John's wort on your P450 list?
Yeah.
Yeah, so it'll interact with these as well. So they interact backwards and forwards, right?
Yeah.
All right, there is something called PrEP, and then there's something called PEP, and you need to know the difference between the two. So PrEP is a pre-exposure prophylaxis. Who in the world would take pre-exposure prophylaxis? Like, yes, if you are in a relationship with somebody that is HIV positive, you can take PrEP and you can have unprotected sex with that person once you get to certain levels within your pre-exposure prophylaxis. So usually there's companies that will send them to you every single month, and you just take your PrEP, and then you're able to have a sexual relationship with the person that you care about without worrying that you can get HIV.
Expensive.
It used to be expensive, but it's not expensive anymore. So the drugs, you need to know the drugs that are used for that. So use tenofovir and emtricitabine. This will also be tested in farm. Okay, so it's, you just need to know. And then they will do HIV testing every 3 months just to make sure that they're okay. All right.
Yeah.
And then there's something called PEP, which is post-exposure prophylaxis. Who is this usually for?
People who have it, right?
What?
People who are exposed.
Okay, can you give me an example of people?
Someone who had sex with someone that is HIV
Incarcerated.
positive.
Okay,
And
somebody-
they didn't know beforehand, but now they know.
okay, so it is a possibility that maybe the person after they had sex with you said, like, by the way, I'm HIV positive, which is against the law, but yes, that's a possibility. But this is also, we see this a lot with sexual assaults, right? Because you don't know the person's HIV status. We see this also with needle sticks in the hospital. That's you guys, right? Okay. So you will be offered post-exposure prophylaxis when you go down to the ER after a needle stick. You have the option of taking it or not taking it. Okay. If you are going to take it, you have to start it within 72 hours of exposure. Because, you know, antivirals, they don't kill off the virus. They just
Slow it down. Or like
prevent
stop
it from
They prevent it from
replicating.
Yeah.
They prevent it from
Replicating.
replicating. All right. And then you have to do HIV testing before therapy. I already told y'all that. You go in on that day, you have the needle stick, you get your blood tested, and they usually come in at 2 and 6 months, right?
Yes.
Didn't we already talk about that?
Yes.
Okay. You will be on 3+ drugs for 4 weeks. Now, you say, like, why would you not take it? Because it's super liver toxic. So you really have to decide, you know, like if I worked in a NICU and I got a needle stick from like a little baby was not HIV positive, mommy was not HIV positive, I don't think I would take it, right? You got to weigh the risk versus benefits because I don't want to ruin my liver when I didn't really need to. But if I'm working in a prison or if I'm working at TDCJ or I'm working, you know, at different places where the patient population of HIV might be higher, then I would consider it, right? And then you test it 2, 4, 6 months. Do we understand that?
Yeah.
All right, let's go over the nursing care. So medication compliance is huge. So much so where you can be a nurse that just does medication compliance for HIV patients. Okay. That is called DOT therapy. What does DOT stand for?
Oh, it's like a direct observational.
Direct observational therapy.
That's
Okay.
also used for
It's also used for TB. You will make sure that the patient knows to report right upper quadrant pain or jaundice because all of these medications are liver toxic. They should not take any herbals and they need to ask about OTC drugs because these drugs interact with like everything and everything also interacts with them. Okay.
Yes.
All right. Your goal with medication is to have an undetectable viral load. That's our goal. Okay. And while they're on these medications, you still monitor for TB and STDs because we know those go along together. Patients that are HIV positive and on ART therapy should not have acetaminophen. How come?
Because liver toxic.
It's liver toxic. All right. And then we're going to teach them things about healthy lifestyle. So like they need to take a multivitamin, don't drink alcohol, definitely don't drink alcohol because these are all liver toxic, but no smoking, no drugs, get a lot of rest, make sure you're getting some mental health counseling because this is a tough diagnosis. You understand what I'm saying?
Right.
All right. Confidentiality is vital and this extends even after death. So even after somebody dies, you can't tell someone that they were HIV positive. Okay. Okay.
Yeah.
Okay. So infection prevention, y'all should already know, but good hand washing, obvi. Avoid all contacts, you should know. The biggest vaccines that they recommend for HIV positive patients is hepatitis, which makes sense because you can also get hepatitis from blood and sex and IV drugs, right? Flu, and the pneumococcal vaccine because they get frequent pneumonias.
Yeah.
Any fever needs to be reported immediately because they do not have the immune system to fight off infection. So they could die very easily. So that needs to be reported. And we do put them on neutropenic precautions, especially if they have AIDS.
Yes.
Okay. Symptomatic treatment. So when they get the severe diarrhea, turn over your paper. Y'all should already know what to do for these. What do you do for a patient with diarrhea?
Give them fluids.
Give them fluids.
Check their electrolytes.
Check their electrolytes. No fiber. Check their electrolytes, fluids,
Small meals.
daily weight.
Daily weight, would not be small frigate wheel.
Sure, you can do small fruit
Really?
meals. That's fine. This is one of the only times in nursing school where you can give an antidiarrheal because they don't have an infection,
'Cause you don't want them to
Okay.
waste.
right? Right, because you don't want them to get wasting syndrome, and they have diarrhea like 25 times a day. Okay. What do you do for the candidiasis? What's the treatment for candidiasis?
Brush your teeth.
Good oral care is good, but what's the drug treatment for oral candidiasis? What drug do we use? We've already covered it before.
Shoot, it's an
Isn't it-
antifungal that's terrible.
No, it's not
No, it's
amphotericin.
not that one. It's like, it's a very simple one. It's very basic.
Starts with an N.
No.
Oh, neomycin.
That is an antibiotic. It's nystatin, 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 nystatin. We covered this in antifungals. All right, and then you want to feed them cooked, soft foods because the candidiasis can cause their tongues to be very sore. It can cause their mouth to be very sore. I wrote all this down for you, so why y'all stop it? Okay, I wrote literally everything. You have to do nothing other than listen and speak back to me. Okay. What do you do for the severe fatigue associated with AIDS?
Sleep.
Lots of sleep, rest, and get some help.
Take naps.
Yes, yes, I will agree with that. They can get hyperlipidemia because
The liver function is.
the liver function is impaired because of the medications, right?
Yeah.
But what would be the drug of choice?
Stats.
The statins, which
Yeah.
are
Liver
liver
toxic.
toxic. This doesn't make any sense. Okay. Some patients with AIDS can get peripheral neuropathies. We talked about that, yes?
Yeah.
Okay, so what's the drug of choice for peripheral neuropathies?
Gabapentin.
Gabapentin, and then we're gonna put them on what complex?
B complex?
We're gonna do B vitamin complex, because B vitamins do
Nerve
Nerve
nerve health. All right, what kind of diet do you think we'd put them on?
Like high
Neutropenic.
calorie.
Neutropenic, high calorie, high protein, very
Yeah.
good, high protein diet. They're gonna go on the B vitamin supplement, right? And they're gonna do a daily weight. How do I know how good their nutrition is doing?
By the weight.
By their weight, but what else can I do?
Albumin.
But yes, see how smart y'all are when you don't read to me. Doo-da, doo-da. All right. Let's see. Okay. If they have a systemic fungus, what drug will I treat them with?
Azole.
Systemic,
Everywhere, right?
everywhere. That's amphotericin. What if they get like CMV or any other kind of viral infection? What's the drug of choice? I taught you all these. Starts with an A.
Acyclovir?
Acyclovir. What if they get a very bad bacterial infection, especially like a pneumonia? What's the drug that I would use?
not good.
It also starts with an A.
Ampicillin?
Azithromycin.
Azithromycin is a great one to use for HIV patients. What about for other pneumonias for HIV patients? I've also taught you this. Starts with a B. Its number one adverse effect is hypersensitivity reactions. It also causes crystalluria.
Oh my gosh. Oh my god. What is it? What is it? Oh, okay.
Can't give it to patients under 2 months of age because it causes kernicterus.
Oh my god. Oh my god. It's
No.
like they're all running through my head.
No.
That's a muscle relaxer.
Shoot.
It starts with a B.
Is it also an
Oh
antibiotic?
wait, is it the sulfan something something? And it's
Oh, it's Bactrim.
Bactrim.
Thank you.
Yes.
Thank you.
Yeah. All right. And then which vaccines did we say we're going to give to HIV positive patients? Flu, pneumococcal,
and
and hepatitis. Okay. What would you teach this patient to, no, what would you teach all patients that are not HIV positive how to prevent HIV?
Good hand washing.
Okay, you can say good hand washing, but
That's not gonna-
Yeah.
Safe sex.
I hate to ever tell somebody, no, you can't say that.
Sex.
Safe sex
If
practices.
you're
Use a
1
condom
year-
every time.
1 year like test, but if you're
Get
sexually
tested every
active-
year.
Visit.
I heard if you're like sexually active or like really sexually active, you do like 3 months.
Yes, if you are with somebody who's HIV positive or you are in a high risk category, then you
Thank
should
you.
get it tested every 3 months.
Avoid
Do not
IV
share-
drug use.
Yeah, do not share needles.
Use
Do
your
not,
own needles.
yeah, try not to do IV drugs. If you do have HIV, they have to notify all of their partners,
Mhm.
past and present.
Yes.
Awkward. Safe needle disposals. We need to talk about that.
Oh,
Always
yeah.
go in sharps, right?
Yes.
And then for patients that are not in the hospital, where do we tell them to dispose of their needles?
They can like, I guess they can have like a milk, like an empty milk.
An
jug.
empty milk jug or an empty coffee can, they can use those too. You know, I'm talking about like the old school
Yeah.
Folgers. Okay.
I'll do that.
What kind of lubricant do we teach them to use?
Non-oil based.
So water soluble
Because of the
only.
condom,
Yes,
great.
oil based condom, nope, oil based lubricants break down
Breaks down.
condoms, yes. Decrease their number of sexual partners, Avi. What was the drug that we used during delivery if mom is HIV positive?
Oh my God, stop.
I won't stop ever.
Prep?
Don't look.
Is it prep?
No. It's a drug, starts with Z.
Ooh, Zaparucap. Why did I think that?
Zaparucap. What did it even say?
Zaparucas. I thought
Oh my
Zaparucas.
God, no, please do not give them singular. That will not help. Zidovudine, say it to me.
Zidovudine.
Zidovudine. Okay. And then we will refer them to counseling in a support group. Yes.
Yeah.
Okay. And family support, very, very important, but you can't tell their family, Avi. Oh,
Unless they agree, right?
yes. Yeah, but even, yeah, okay, that's
just
good.
wanna know.
Yes,
If
you
they
can.
sign off on HIPAA saying my family can know that I have HIV.
Yes, you can tell them. We do encourage the patient to tell them, but yes, if they will not do it, then yes, you
So how do you even do counseling if you can't tell them that they have HIV though?
can't tell the family.
Yeah, like how do you do counseling between that?
What do you mean?
Like, you mean,
Like if
are you-
they cannot tell, if you cannot tell.
Oh,
the
you're not
family-
doing family counseling. You're doing counseling just for the patient.
Okay.
So they learn how to deal with the disease.
Okay.
Yeah, refer to counseling. And then family support is vital. That's separate thoughts.
Oh, okay.
Okay, all right. So, oh, I also forgot in diet to include low residue diet. What does residue mean?
Fiber.
Fiber. We want
Fiber.
low fiber diets. We don't want to move it even further,
no
right?
corn,
I
That's
don't
the one
really
thing.
care about corn.
Corn is really nice fiber.
Corn is for diverticulitis. Yeah, I've never heard
Oh,
that
yeah.
HIV patients
It
can't
also
have corn.
obstacles, they don't want corn because they can get like corn.
That just
Yeah.
made me want to throw up in my mouth, but yes.
I'm sorry.
Anyhow, all right, things that they need to report. So you need to teach the patient signs and symptoms they need to report. Fever, how come?
Because they can't.
Infection.
Fired.
Change in level of consciousness,
Because
Like a neuro thing?
syphilis. like-
AIDS, dementia,
or
AIDS,
AIDS.
dementia.
dehydration. Where'd that come from?
The electrolyte, the diarrhea.
The diarrhea,
yeah,
jaundice
liver
From
from
toxic
the liver
drugs,
toxic drugs, seizures,
The dementia.
AIDS, dementia, new onset rash. Oh, I haven't told you that. A lot of these drugs will cause rash because remember all of our liver patients
The itch,
itch, right? And I'll teach all that more later. Oral lesions. That could be
like,
Thrush.
candidiasis or the leukoplakia, right? Chest pain, shortness of breath, and cough.
In fact,
Yes,
like TB.
like a pneumonia, or it could be TB as well.
Yeah.
Okay. All right. Do we understand HIV?
would rash also be from infection or
Like what kind of infection? Like shingles or something?
yeah?
I mean, maybe.
Oh yeah, what about like vaccines for chicken pox? Because we're worried
No
about
live
them
vaccine,
getting.
right?
They can't get live
No
vaccines,
live vaccine.
Oh,
right? No live vaccines for HIV. And which vaccines are live?
The V.
The V.
The MMR.
MMR,
Varicella, right?
varicella. So MMR, varicella, which is chickenpox.
Yes.
And then there's another one that's the rotavirus is the other one. It's an oral.
For like the stomach.
So they cannot get live vaccines once they are immunocompromised. Okay?
Right.
Questions, comments?